Good evening. It's Jacqueline Underwood in MFT6102 Marriage and Family Therapy Program at North Central University. This is week number 5, and it is provide a diagnosis and diagnostic criteria and codes. And I had to choose one of the subjects that were in the assignment, and I chose Sylvia Plath. In week five's assignment, I am to identify, support, and rule out diagnoses, psychopharmacology treatment, psychological treatment, family therapy based treatment, and biomedical treatment. At the end of this presentation, I should have been able to explain what those 5 points are and how they relate to providing a diagnosis using a diagnostic criteria and codes. Sylvia Plath, a poet whose work was celebrated posthumously after her death, suffered from prolonged depression from the majority of her life. I would say that she died at 30 years old, and she attempted to take her own life for the first time when she was a teenager. She did have some personal stressors that could have very well been the trigger of her depressive bouts of depression, and that was the death of her father. Sylvia attempted suicide several times. The first time she was not formally diagnosed, and the second time she committed suicide is when she was formally diagnosed and she was placed into a psychiatric hospital for 6 months and given psychoconvulsive therapy. It appears after those 6 months that Sylvia did have a better outlook. The depression was gone, and she went back to her life. After that, however, Sylvia made several attempts to commit suicide over the course of the years that she attended college and began writing. She was a very talented young woman from the time that she was a child up until the time that she gained notoriety and success as a poet. Sylvia ended up getting married to a fellow poet, Mr. Hughes, and they, for all intents and purposes, appeared to have been having a great time together. They were married. They appeared to love being together, working together. And when his book was published and he began to receive notoriety for that work, it appears that Sylvia's behavior, her moods may have started to change, or that could have very well been the onset of her first depressive bouts during the course of her marriage. Other instances that I noticed, she would get moody when she would go to parties, and if they were talking about her husband's work, she would become moody. It would appear that she would be following and watching her husband during his conversations with other people. When her work was addressed and then dismissed, I thought that I could see in her eyes that she was having some type of I don't know, some feelings of unworthy, or that her work wasn't as good at that moment. She began to have problems with her husband at home and her marriage. It appeared that everyday stressors began to bother her. Her ability to work and write at the same time and take care of home. There were several times where she would just lack concentration, which is another one of the symptoms for depression. Now, Sylvia also would go on to write well within her depression. However, in the latter part of her life, her marriage, I should say, her husband began having an affair with a friend of theirs, and that seemed to trigger a bout of depression that lasted, as Sylvia said in her explanation of what she was feeling, over 7 months. So we see here that Sylvia, it doesn't appear that she was on medication. There was no anything that was allowing her help, and she was not around her family. So there was no one to really see that she was starting to descend into depression. Once Sylvia's husband left, it appears as that is when her depression began in earnest. There were times when she had the birth of her child. I thought that she was, showing signs of disconnection, didn't seem to be pretty happy about the birth of the baby, spending time with her daughter, even though she was not. Abruptive with the daughter. She was not mean or angry. She just did not seem to be enjoying the task of motherhood. And as she began to live by herself, she began to see other people, and she talked to those people about death, about depression, about suicide, which is another one of the symptoms for depression. Sylvia would go on to commit suicide in the final days of her life. Not only did she commit suicide, but it appears that she planned the suicide. She experienced, in her words, some derealization of some disconnection from her body, from her life. And she explained this to one of her friends, a publisher, that she was, having some problems. There was a day when she was very upset, just not being able to focus. She did call her doctor, and he did give her medication. It appears that he tried to get Sylvia help, but she refused the help, and he went on to get someone to be there with her, but not full time. Sylvia ended up committing suicide by carbon monoxide poisoning. After her death, she went on to be celebrated. Her work made changes for the literary world. She was heralded for her poetry, which was confessional poetry, I believe is what it was called. So her daughter, her husband, since they were still married and only separated, was given her estate. And so it was for him to do what he would with her work, which, by the way, before she died, she left numerous manuscripts, numerous poetries that she seemed to have completed and finished during her depression. Over the years, her husband went through a lot of having been accused of being the person who caused her death. He destroyed some of her manuscripts, did not want the world to see what she had written. 30 years later, he published a manuscript that he had, and to celebrate her 30 years of after her death, her two children went on to grow up. Her daughter became a poet and an artist. Her son ended up committing suicide. What are depressive disorders? And I just want to talk a little bit about that so that it is clear that I understand that depressive disorders are a type of mood disorder that are persistent feelings of sadness or hopelessness, occasional suicidal thoughts or actions, and impairment functioning in daily life or work activities. And so Sylvia was, however, diagnosed with major depressive disorder or clinical depression. And under the Diagnostic Statistical Manual 5, disorders have to be classified with specifiers. And so the major depressive disorder, which I looked for, I could not find any specifiers for major depressive disorder or clinical depression. So what is major depressive disorder? Clinical depression, and is symptomatic of depressed mood at length during waking hours. Most people are sad. They have very low points. Clinical depression is symptomatic of just being depressed during the waking hours and long periods of depression at that. A loss of interest in routine, relationships. The symptoms normally last about 2 weeks. We did notice that on several times that Sylvia was, she did appear to be happy. She did appear to, live a normal life. At periods, but there were those moments when she would start to have a relapse, and from what I could see in the film, it looks like that maybe it lasted for a little while, and then she'd be okay, and then she'd come out of it. But then it was the stressors of her husband's success of his affairs, philandering, that seemed to continue to trigger more and more symptoms in Sylvia's mood, and her behavior changes. She suffered from fatigue, insomnia, reoccurring thoughts of suicide, restlessness, loss of interest, and also Sylvia ended up having a significant weight loss, which is also one of the symptoms of depression. There is a particular population that is at risk for depressive disorders, and that is mental illness usually manifests itself in children as diagnosable disorder or addictive disorder between the ages of 9 and 17. According to the National Alliance for the Mentally Ill, it can be triggered by traumatic experiences, the environment, the death of a loved one. Sylvia lost her father at the age of 9, and after that time, that's when she tried to commit suicide. And we noticed that over the course of the movie, of her poetry and her writings, that she did make references to her father. And some of it was pretty dramatic, pretty angry, as if she was angry with her father for dying, for leaving her. And I see this train of thought. It kind of shows itself when she's talking to her husband and she says, "Do not ever leave me." I think that it was during those periods of time that she was also experiencing depression, and she knew that she would not be able to handle it. As a matter of fact, her mother said to her husband, "Do not ever make her unhappy." And I think that that was a precursor that Sylvia cannot handle being unhappy. So I think that we can see that. Oftentimes, clinical depression is misdiagnosed. It's often masked or hidden. It is hidden behind other coexisting comorbid conditions, like, say, anxiety disorders, alcohol and substance abuse, personality disorders, and also physical diseases. The most common of those comorbid conditions would be anxiety disorders, and the reason that can be, the most common one is that it does coexist with depressive disorders. Again, I try to get a diagnosis, a specifier number for through the DMS. However, like I said, it was not available, but there are symptoms and signs, and like I said, Sylvia exhibited at least 5 or more of the symptoms. We know that her depression lasted over 2 weeks, and we do know also that it was not because of drug side effects, so we can rule that out. And also, it was not about current grief, something that was obviously that was going on at the time in her life. It didn't. In the beginning, it appeared that she had some issues with her husband writing and success, but to that end, that seemed to clear up a little bit. But it could have very well just been an underlying thought, because towards the end of her life, it did, and she said it, she did not feel unworthy. She did not feel guilty at any time. So. Again, she did have significant diminished interest, no pleasure in daily activities, appetite disturbance, sleep loss. We did notice her wrestling with sleeping up late, going to bed, and waking up early. And as she began to live by herself and talk to different people as she was writing, she had repetitive thoughts about death, dying, and suicide. The one thing that I noticed about her, and the poet who she was speaking with, who was her I want to say publisher or just a friend who was helping with her work, he had mentioned to her that he had ideas, he had attempted suicide and that it had failed as well. But he did say to Sylvia, "I don't think that you should give up. I think that you should try." Obviously, she, had 2 children, and he wanted to make sure that she tried to work through the depression. I didn't hear him say, "Do you have a doctor? Have you been diagnosed?" Or any of those things. Well, support for Sylvia having clinical depression. Again, like I said, she was formally diagnosed by her doctor when she was admitted into the psychiatric hospital. What we can rule out is that she did not have drug, alcohol abuse. She didn't have any drug abuse. It wasn't grief or anything like that. And the other things that I'd like to rule out based on supporting evidence is that I thought that she might have had a mood disorder, but you have to have at least a certain amount of numbers of symptoms in order for it to be considered a specifier, to be given a specifier and a comorbid condition. So the same thing with bipolar, the same thing also with depressive disorder. So she is, however, at high risk for depressive relapse. She would need to take medication, and also she wasn't taking her medication. And this is what happened when she lapsed into a major depressive disorder or depression at that time, I should say. She did say to her doctor that her current symptoms of depression during the last phase of her life, that her work habits had changed. However, she was still able to work. Depression symptoms have went from worse to severe. She's constantly agitated, suicidal thoughts, insomnia. She would take sleeping pills in order to be able to help her with sleeping. She would wake early. And she, again, I mentioned earlier that she did suffer weight loss and multiple attempts at suicide. So if there are no other comorbid conditions that exist, then we can safely say that Sylvia was suffering from major depressive disorder. Also, I just want to talk a little bit about rule out. The ideal of ruling out the diagnosis is that if A, B, and C all equal the primary condition, then we can say that it has comorbid conditions. However, but if A and B are present and only C does not have the symptoms, then we can rule out C as being a part of the depression. And in Sylvia's case, she did not have mood disorder. She did not have she didn't have mood disorder, nor did she have other depressive symptoms or comorbid behaviors. First, I want to talk about psychopharmacological treatment. From what I understand, psychopharmacological treatment is the treatment of the depressive disorder with antidepressant medications. And Sylvia was given a an oxidase inhibitor, and she was taking that medication at the time of her death. However, it does have a time limit before it is into your body and able to manage the symptoms, and it doesn't appear that Sylvia had been taking it long enough before she committed suicide. So psychopharmacological treatment would be medications, and it helps to restore the brain's imbalance that causes depression, and also the medication is used with therapy. Next is psychological treatment. Major depressive disorder is managed with psychotherapy and medication. Medication's efficacy overall and the time that it takes to start managing the symptoms and bringing the depression under order is 4 to 6 weeks in order to receive maximum therapeutic benefits. Sylvia was being treated. However, again, she had not been on the medication that long. It was a new prescription. And at some moment, I thought I saw her hold the medication in her hand and not take it. And I wasn't sure about that. Ways of treating depression through psychological treatment would be psychoanalytical therapy, electroconvulsive therapy, which is shock therapy for depression, electric and insulin shock treatment, which Sylvia had before for her attempt of suicide. And she was, again, you can be hospitalized in a psychiatric hospital in order to be monitored by your doctor to be able to help with the maintenance so that the relapse is not as reducing the risk of relapse, I should say that. So, family therapy-based treatment. Family therapy-based treatment is a treatment. It's family therapy, obviously, is with the family and the entire unit. And how family-based therapy works is that the family and the client who is suffering depression would come in for therapy together. The reason we would want to have family therapy is that the family would be able to help Sylvia maintain her medications. They would help her put her life back together, become more socially aware, help work her job, and most of all, they would be able to make sure that Sylvia or the client would know that she is loved and they understand and they are there willing to help and support her through her depression. This would allow for lower risk of relapse because the family would be there to help her monitor and manage her depression. Also, family therapy would be, like I said, for the family. The family could provide information that Sylvia wouldn't necessarily be able to provide about her depression. They would bring that information. And then depending on how long the depression episode had begun, the family might have issues with it. They might have feelings about it, and they may need to come and have therapy as well to understand what the diagnosis of major depressive disorder is and how it affects Sylvia and how it affects their lives as well. So, also, it comes with treatment. So how do we diagnose how we're going to have treatment? So family therapy, it reduces depression and the risk factors for future depressive episodes, okay? And our treatment would be based on four key components. And that would be giving the family and Sylvia homework assignments, role playing, and reading assignments, as well as modeling behavior. The one thing that would need to be considered is that the therapist would not wait until the client would say that they're feeling better. During the course of the treatment, they would ask if there was any moments when they felt better or if they felt more connected and the depression was lifting. Biomedical treatment. Biomedical therapies involve the use of medication and or medical procedures to treat psychological disorders. Psychological disorders have a biological cause, and effectiveness is measured by efficacy, research, and effective studies. The effectiveness of the studies that they have participated in. Biomedical treatment is based on the premise that the mind and the body works together. So if the body is out of sync or if the mind is out of sync, then that means that there's probably going to be some problems during the course of that person's life, or they're going to have depressive episodes because they're not feeling it well, or they're physically ill, or that they're mentally out of sorts. So maybe they're going to have feelings of their body being out of whack. So what can happen is that it can be treated with drugs, or four classes of them: antipsychotics, antidepressants, and anticycling agents, and hypnoanalytics. Sylvia was treated with antidepressive medication, also electroconvulsive therapy. And electroconvulsive therapy, if I did not mention that, it is a current that is ran through the brain in order to induce seizures, and in order to reduce the amount of severe mental disorders. And so Sylvia did have electroconvulsive therapy as well. And then there's psychotherapy, psychosurgery, which is a neurosurgery. And this surgery happens to be where they take a part of your brain out, but that's rarely ever used anymore, unless the symptoms, the medication doesn't help, and the other therapies do not work. I just want to provide a summary of my diagnoses for Sylvia Plath, and how I, as a therapist, would deal with Sylvia's depression, maintaining that depression, and pulling her life back together. We know Sylvia suffered. We know that she had, that her father died at 9, that she had some, that may have been the onset of her suicide. We don't see whether or not we know her mother was very supportive of her, but she went off to school. And during that time, she did not have familiar support, nor was she, it didn't appear from what the information I received, that she was receiving therapy as well. And she was, and I don't know, it only appeared to me once in the movie that she was even being treated with psychopharmacological treatment, or psychological treatment. Again, like I said, I didn't see her with a family therapist or anything like that. However, we do know that at the end of her life, when she spoke with her doctor, that he was using medications, as well as trying to give her some therapy. He alluded to the fact that he did try to help her. I do believe that if Sylvia had had family as a support system, therapy, and maintained her medication, the biomedication, she could have lived and managed her mental illness. However, she was alone, unmedicated, and her depression went from, in her own words, worse to severe, and she did not get help before ending her own life. My name is Jacquiline Underwood, and this is my Week 5 presentation. Thank you.